Hello everyone, this is Pamela Jasayan, and this week we're doing postpartum hemorrhage. So postpartum hemorrhage, what is it? Well, it's the leading cause of maternal death globally. 35% of women who die of something related to labor and delivery, it's usually because of postpartum hemorrhage, and that's usually 14 million women around the world globally. What counts for postpartum hemorrhage is if they have a blood loss of more than 500 ml after a vaginal birth, and if they've had a C-section, it should be over 1,000 mLs. So what happens with postpartum hemorrhage is that the uterus fails to contract and retract after birth. This is called uterine atony. It's the most common cause. So if it fails to do this, the blood vessels are wide open and you just gave a birth, so it's very easy to bleed out. So we have some clinical manifestations related to the blood loss. I broke them down into three three levels. I just got this from the textbook. But if you have mild blood loss, which is 20%, you would have diaphoresis. Your capillary refill would be increased, your extremities would be cool, and of course you would feel very anxious. Moderate, 20 to 40%, your heart rate would increase. You would have postural hypotension, so dizziness when you stand up, and oliguria. Severe, which is more than 40% of blood loss, hypotension, agitation, and confusion, and of course, hemodynamic instabilities. Risk factors, so things you just want to watch out for when you're taking care of patients. So they could have an overdistension of the uterus, and some causes of that is polyhydramnios, multifetal gestation, and if they've had a large baby. Also, uterine muscle exhaustion, rapid or prolonged labor, and oxytocin use, and uterine infections, which would present with a maternal fever and or be caused by a prolonged rupture of the membranes. Other risk factors would be an atonic uterus, which is the most common cause for this. If they gave birth and their placenta wasn't delivered completely, or if they have, if they had a precipitate birth or operative birth, and a history of uterine injury or coagulation disorders. So for assessing this patient, you want to assess for all those risk factors that we just talked about. Just keep in mind about that. Assess the uterus, assess the tone. So you just want to palpate it, and it should be firm. But if it's not, it could be a uterine atony. But if it's soft and boggy and it's off to the side, it's not midline, it could indicate a full bladder that's like causing the uterus to go to the side instead of being in the middle, like as it should be. Of course, you also want to assess the lochia, which is the blood coming out after. You just want to make sure that you're keeping count of the pads that they're using, how often they've changed it. Look at the blood, see what consistency is it. Is there a lot of clots, the color, and just look around the peri area after that. And if there's a hematoma around the vaginal area, could be a sign of postpartum hemorrhage. And checking their vital signs. Blood loss would indicate a higher heart rate than their baseline. Their consciousness would be lowered, and they would have a lower BP depending on how far they are on the blood loss. Managing, so this is just aimed at improving their uterine tone so it can contract and stop bleeding. The first thing you want to do is call for help. So rapid response. You want to massage the fundus. You want to do this for as long as you can, and it's going to be very aggressive. You don't have to be gentle at it. It's like CPR. Of course, you want to have IV fluids. They're losing blood, so you want to keep their blood pressure up so they can still perfuse. So IV fluids, bolus, and you want to give them certain medications that will help their uterus gain its tone back. And the first one that people usually use is oxytocin, which stimulates the uterus to contract, which will help stop the bleeding. So with this one, you just want to monitor the vital signs every 15 minutes and keep monitoring the uterine tone for effectiveness. The next one, misoprostol, it does the same thing as oxytocin, but it's a prostaglandin analog. You should never give this undiluted as a bolus injection in an IV. Could cause some complications. The FDA doesn't list this as a med that's for treating postpartum hemorrhage, but it's usually used for this. Some contraindications for this medication: if they have cardiovascular disease or pulmonary or hepatic disease, you just have to be very careful using this. Also, if the woman has asthma, you got to use caution. And for the vital signs, you want to make sure you're checking it for every 15 to 30 minutes and just monitor for the complications like hemorrhagic shock and DIC. I believe